I was just wondering about the sort of creeping assumption that all counsellors are fully versed in body therapy and somatisation and the understanding of, and speaking for myself, that wasn't the case. Obviously, since I've been working in trauma, I've got more and more familiar with it. And I think a lot of counsellors, and I include myself in this, can work in our heads very much. So for those of us that are wanting to move downwards from our heads and incorporate more of our bodies, where do we start?
The breath is an amazing place to start, just because we have it with us all the time. So slowing down the exhalation helps us activate the parasympathetic branch, so that's going to help soothe us. Some people find counting stressful, so you might just want to imagine also making sure you're breathing from as low in the belly as possible. Sometimes people find it gets stuck higher up or in the middle. Not to add to the stress response by thinking, I'm not breathing right. You're breathing, you're alive, you're fine. But just aiming to calmly and kindly bring it down, make it longer, if that feels good. And just recognising those times, I'm breathing quite shallowly, I can consciously, but also if you're with a client you can't do this, but if you're out and about, I mean, even like here we've got the table, you could tense and release the thighs, you're kind of honouring the body's natural fight-flight response without getting up and running away or punching anyone. So, I mean, this is stuff I learnt from the yoga therapy training.
Yes, I was going to ask you about that.
Yeah, I did that with Heather Mason at the Minded Institute, and she'd blended yoga, mindfulness, neuroscience and psychotherapy. So very much looking at like anxiety, trauma, depression and what happens neurologically and how we can use our bodies. You've got the vagus nerve, 80% of the signals go body to brain. So us thinking calm down isn't necessarily going to help, whereas moving our body, sitting in a more, I mean, he talked about the posture earlier, the feet on the ground, you're automatically sending the brain signals off. I'm not prey, I'm not making myself small, how we sit in front of our laptops, I do. And it's just that more, it's sending soothing signals then to the whole body.
Yes. So you mentioned yoga there.
Yeah.
Some people might go screaming to the hills at the mention of that.
Absolutely.
I might have done at one point.
Yeah.
But introducing it into our self-care practice in a gentle way.
If you want to run for the hills, that's fantastic. I'm not a runner, but running, that's naturally honouring the fight-flight impulse. Any kind of strong movement, it might be push-ups, it might be, I've got a mini trampoline at home, which is brilliant. It might be swimming, whatever you want to do, trying to force yourself into something that someone else has suggested. If your entire body is screaming, no, listen to your body.
But for those to whom yoga does appeal...
for the people who like yoga, absolutely do it. It's wonderful. Experiment with different classes, experiment with different teachers. Find the poses that challenge you and the poses that soothe you. I mean, all our bodies are different, but yeah, wonderful.